Hey there! Did you know Kroger always gives you savings and rewards on top of our lower than low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details. Hey there! Did you know Kroger always gives you savings and rewards on top of our lower than low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg. I'm your host of Yoga Birth Babies, and this is our second week of our 2-week re-release series of our most popular podcast episodes. So last week, we heard from Morgan Michalowski about healing from a vaginal birth, and this week, we are hearing from Dr. Sara Reardon and Dr. Jessica Reale, healing from a cesarean birth. So we get deep into the conversation about how much movement is suggested in the first few days and weeks after having a cesarean, the aches and pains that fall within the realm of normal and what to be expected, warning signs that might fall outside of normal and require consulting a care provider, as well as talking about scar mobilization, and of course the effects of cesarean on the pelvic floor and the abs, because you know I love talking about the pelvic floor and abs whenever we can. So to have this conversation, I have Dr. Sara Reardon. She is a doctor of physical therapy, graduating from Washington University in St. Louis and board-certified women's health physical therapist. Sara specializes in the treatment of pelvic floor disorders, including changes that affect sexual health and wellness, and is the founder of The Vagina Whisperer, an online resource for pelvic health education for people worldwide. Dr. Jessica Reale is a doctor of physical therapy and board-certified specialist in women's health and has been working with people with pelvic health difficulties for over 10 years. She's the founder of Southern Pelvic Health in Atlanta, Georgia, a specialty clinic focused on helping people optimize their pelvic health. Dr. Reale received her Bachelor of Science in Kinesiology from Gordon College in Wenham, Massachusetts, and her Doctor of Physical Therapy at Duke University in Durham, North Carolina. So, a wonderful podcast there to help all those that may be planning a cesarean or just to have the knowledge in case you go into birth with an unplanned cesarean as the result. So I hope you enjoy that. Now, before we get to that, I just want to remind you that if you're feeling some aches, some pains, and you're pregnant or postpartum, head to our website, prenatalyogacenter.com, and download your free downloadable guide, 5 simple solutions to the most common pregnancy pains. And I say it every time. It says pregnancy pains in the title, but it also is fantastic for if you have postpartum pains. Because I know holding a baby, carrying a baby, pushing a stroller can do a number on your neck and shoulders and back. And then a reminder about our classes, how we're continuing. So, we've been in this COVID situation for 2 years, over 2 years, and it opened doors that I never would have thought. So I guess we can look at that as a silver lining. So we are offering our online classes 7 days a week so that no matter where you are, you can tune in for pre and postnatal classes. And then, of course, we are thriving on the Upper West Side of New York. So I look forward to seeing you in class for a little prenatal, a little postnatal. Of course, we have all our workshops in person, online, and on demand. So check those out. And then the last thing I want to share, because I know that not only do pregnant and postpartum folks listen to the podcast, but we have a lot of people that are interested in our teacher training. We have a very, very thorough, in-depth training for both postnatal yoga and prenatal yoga. So check that out on our website and you can look at the dates. Some of this will just be online and some of it's in person. All right, that's enough. So let's take a super quick break, and when we come back, please enjoy my conversation with Jessica and Sara.
Hey there! Did you know Kroger always gives you savings and rewards on top of our lower than low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Hi, guys. Hi, Sara. Hi, Jessica. I am so excited to speak with you guys. Thank you for some of your time.
Thank you so much for having us.
I'm excited to be here.
So I really think the idea of healing after cesarean is a topic that's not covered nearly enough. We know that 1/3 of the listeners will either have had or will have a cesarean birth. And I think it's an important topic to really dive into and understand what happens with the body during a cesarean, how to heal from it, how to take care of it. So yay, I'm so excited. All right. So before we dive into that, I would love to hear a little bit about each of you and what brought you into specializing in pelvic health, and also how the two of you ended up working together.
So I'll start. I am Sara Reardon. I am a pelvic floor physical therapist living in New Orleans currently, and I have a small private practice here where we work with women and men actually in the community of New Orleans, and we also offer online classes and telehealth sessions. So I started my career almost 15 years ago in pelvic floor therapy. I graduated from Washington University in St. Louis and just really thought it was so interesting to learn more about my own body as a woman and my own pelvic health, and to be able to help others with something they didn't know there was help for. So I've been doing this since I started, and Jessica and I started teaching together for a institute that teaches pelvic floor classes about 5 years ago. And then in this past year, during the time of COVID, we started offering online classes and courses to people in the community and other physical therapists. So we are dear friends, physical therapists, and just colleagues have been working together and share the same passion.
Oh, I love that. I'm so happy to hear there is so much more pelvic floor physical therapists out there and just more awareness. So thanks for the work you do. And Jessica, let's hear a little bit about you.
Yeah. So similar to Sara, I'm a pelvic floor physical therapist. I started into this specialty in PT school. And it's interesting because, I think some people go to PT school knowing they want to be pelvic floor specialists, and that wasn't me. But I ended up doing a rotation and just fell in love with the population. I think all of the things that we treat, bladder problems, painful sex, constipation, just tend to be things that people don't talk about, but are often taken for granted until they don't work well. So I think as a student, I was just blown away by the difference that we're able to make for people and just the improvements we're able to make for their quality of life. So I jumped into it from there on, and I now own a pelvic health practice in Atlanta area, and we treat all people with pelvic health problems, and we've grown, and I just love it. But it's interesting, Sara and I, like Sara mentioned, we teach for the same organization and do continuing ed work, but I really think that we connected a lot the first time that we taught together, and we were teaching a course in Atlanta, and after the course, we were out at dinner and we started just having this great conversation about birth. And we both were sharing our experiences with birth. And I think at one point, like, all of us were crying a little bit because it just is such a powerful experience that all people go through. And I think Sara and I just both have such a passion for bringing knowledge to people who are so underserved, and there's just such a huge lack of knowledge. And thankfully, now with social media and with every podcast like this, people have more access, but I still think that we don't reach the people that we could reach. And so I think that kind of spurred us connecting together. And when the right opportunity hit with COVID, we just jumped in with a lot of online education, and it's been a really fun journey together and reaching more people.
I'm so glad you are, because I think so many, and I don't know if actually, I'm just throw this out there, totally unprepared for you guys, but do you happen to know any statistic of how many people suffer from pelvic floor issues, either after having a baby or just kind of the general population?
So it's a totally variable number. And there are studies that show that, 70% of women, within the first 3 months after giving birth may experience an abdominal separation. Up to 50% may experience pelvic pain or painful intercourse. We know that with aging, there's a large portion of the population over the age of 65. I believe it's 50% that will experience urinary leakage. So, there's a lot of different statistics thinking about where in someone's lifespan they are. I think what's really important is that we all have pelvic floors, and, these are issues that can start as early on as puberty, or, even teen years when someone is a female athlete or learning to insert a tampon or having some of their first sexual experiences, all the way until someone is in their elder years and, potentially, even living in a nursing home. We see a lot of women and also men with incontinence and some type of pelvic floor issues. So, again, I think to echo what Jess said, that we often don't know that there is even this part of our body that exists until something goes wrong with it. And then you can kind of just think, oh, maybe this will get better on its own, or I'll take this medication or do this procedure. But physical therapy hasn't traditionally been thought of as a treatment option for that until more recently. And I think we're really seeing a lot of people come to us either to prevent issues or to start tackling issues earlier on than thinking they just have to deal with them.
Yeah, I absolutely agree. I remember after my first, I had a very long pushing stage. I pushed my first child out for about 5 hours. So my abs and pelvic floor were a hot mess after. And I remember just being told, I went to see a urogynecologist, and she's like, make sure you're Kegling, just keep Kegling. And I'm like, there has to be more to it than that. And so cause I took it, I'm like, yes, I will do this. I will put it all back together. And I went to a pelvic floor. Well, I went to one who's like, your chakras are spinning in the wrong way. And I'm like, I ain't peeing myself. I don't care what my chakras are like. So I went to someone else who's a little more practical. I needed some down to earth, like give me some science. And it was so much more. I'm like, oh wow, I really learned so much more about the pelvic floor than just keep Kegling. So from that point, I've been such an advocate of pelvic floor PTs. I kind of feel like had I not been in the yoga path, that would have been a path I would have taken. Although I don't know if I could have passed the science. Anyway, so I'm just so thankful for the work you're putting out, because people are often just told, oh, it's normal. You had a baby. You're going to have leakage. Just Kegel. And we just know there's so much more to it.
Yeah. And I think that it's like Sara was saying, more and more people are seeking out and being proactive. But the crazy thing is that it still is such an underserved population that despite that, I think so many times people are reactive instead of being proactive. And that's part of, I think, how our healthcare system is kind of set up. But as you were talking and as Sara was talking before, I kept thinking, gosh, how great would it be for so many people if having this wellness piece and being able to really recover well and rehab their whole system was something that was just a standard thing in our country. And it's not now, but I really wish that it was, because I think it would make such a huge difference.
Yeah, like in France, where that's part of their. So let's start to dive into the idea of cesarean recovery. So what are some considerations people should keep in mind when recovering from a cesarean birth? Because I'm sure you work with that population quite a bit.
Right. So, I think it really starts from the very beginning. So around 30% of individuals will birth their babies via cesarean section. And really recovery and education and recovery needs to start on day one. This is major surgery. And the tricky part is about a cesarean birth is that not only is the birthing mom or birthing person recovering from major surgery, but they're also trying to take care of another human being now. And so, I think it starts in early hospital interventions with teaching people simple things like how to get out of bed, to protect their abdominals, how to have their first bowel movement, have their first urination, as that can be affected after surgery, how to take care of their scar, things to look out for infection, how to, once their scar is healed, how to work on desensitization and scar massage. So some of those just kind of very basic healing and recovery aspects. And then again, just as if you had an individual who had a knee surgery or a back surgery, they would get sent to physical therapy for rehabilitation. And so thinking about these women who are giving birth, if they have a cesarean birth, physical therapy should be automatically part of their postpartum recovery plan. We typically see people in our clinics around 4 to 6 weeks postpartum to just start re-strengthening, reconnecting, working on scar management, things like that. In addition, there can also even be things that are done pre-childbirth. So if someone knows they're going to have a repeat cesarean, doing some stretching and some breathing and, working on their own or with a physical therapist for some of those things to prepare for birth. So I think that that's one thing. And then also for a lot of moms, it's an emergent cesarean section. So thinking about the kind of emotional, psychological aspect as well, I think is really important.
Oh, I 100% agree. Because, I think so many times people are told, oh, the baby's okay. That's all that matters. But that's not all that matters. It can be really emotionally scarring, not just physically scarring. That was a great point. So knowing that a cesarean is major abdominal surgery, and a new parent has to have some movement, how much movement do you suggest in the first few days to weeks?
That's a great question. And, to echo what Sarah was saying, a cesarean birth is and what you just said, a major abdominal surgery. And it's funny because I think back when my husband had an appendectomy and, it was laparoscopic and he had his surgery and then he spent like the next several days, like in bed, but getting up a little bit. It was like sleeping a lot and all this. And then I think to my first cesarean and I had been in labor for 37 hours and hadn't slept for 2 days. And then I had my cesarean and then I'm trying to learn how to breastfeed and care for this baby and so tired. And so the recovery is, while, it's a major surgery, it's a different experience when you're the parent and you have all this to do for yourself. And so, I think that, first be patient with yourself. Be patient with healing and know that healing is so, so, so important, and correct healing is important because you want your incision to heal well. You want to manage what's happening with your scar tissue. So because it can impact everything around the core and the pelvis. So I encourage people early on, in that first day to just let their body rest. You can start getting up that first day, and we encourage you to do that. Early movement is very, very useful. And so what you might even do is just get up and just kind of make that trip to the bathroom and back to your bed, and be aware of your movement as you're doing that. And so trying to make sure when you're getting out of bed, one little tip, roll to your side first and then use your elbows to help push yourself up into a sitting position so that you're not having to activate a lot of your abdominal muscles initially. And then as you stand up too, try to lean your body forward so that you kind of put your nose over your toes to move your weight forward, and then use your hands to help you as you're pushing and moving into standing.
That makes such good sense. Yeah. Oh, I'm sorry. I think I cut you off.
No, you're good. You're good. So during that first day, you're just kind of taking some time moving a little bit around your room. That second day, you can start getting up and moving a little bit more. And so start walking, having someone with you first. You can actually use the bassinet in the hospital to support you a little bit. So you can actually use your hands and push through that bassinet to help your trunk support. And start walking within what's comfortable. But during that initial, so those first few days, you're walking a little bit, but then spending time sitting and finding a really comfortable space where you can sit. So, you'll be in the hospital, but then once you do head home, you want to build a little spot for yourself. So have a chair that's firm, not too deep, that's supported, using cushions to help you with any breastfeeding or feeding your baby. And during those first few weeks, you want to be healing. So minimize stairs those first few weeks, minimize lifting of another child. If you have another child, it creates some challenges. My daughter was almost 3 when my second was born, also via cesarean. But having times where you can have your second child kind of cuddle up to you on the chair and stand and crawl up on, sitting next to you, avoiding your incision can be really, really useful. And then during those first 2 weeks, try walking in smaller spurts. So getting up and moving for a couple minutes and then coming back to your spot. And you can use also a stroller can be really, really nice to help
like
support.
a walker?
Well, yeah, like it basically is. And so you can use your stroller to give you some support initially too, but you really want to take it easy initially and listen to your body. If you feel increased abdominal cramping, if you notice increased bleeding or anything like that, back off. I almost think that this is one of those few times in our lives where like, it's okay to just rest, to take it easy for yourself.
What about breastfeeding and picking up the baby? So I'm thinking about the incision and the pain.
So one of the things that we recommend early on is not a waist trainer, but an abdominal support. So that's kind of a very gentle, soft abdominal support that you can kind of use starting in the hospital. I think often people worry like, oh, I don't want to get too reliant on it, but it really is, again, after abdominal surgery, you do want to have a little bit of extra support because there are day-to-day life duties that you're going to be doing. So that's a big piece of it. Also, we teach people how to get out of bed, how to bend over and lift properly. So, really trying to keep your back straight as you're doing so, bending at the hips. Another tip that we use is exhaling when you are exerting effort. So, again, in the beginning, you do want to try to minimize heavy lifting, especially if you have other children. I know that that's so much easier said than done, but, exhaling when you're going to exert effort so it doesn't put any strain on your abdominal wall or that incision. And so just little tips like that of, using a support binder, bending at the hips so you don't strain your abdominals, exhaling with exertion can really make a difference in helping someone do the things they need to do for their life and not injure themselves, but also feel like they aren't able to, take care of their families, take care of themselves, those kind of things.
Yeah, I had, when my second child was 3 months old, I actually had hernia surgery. So that's the only kind of relationship I have to abdominal surgery. And I just remember being floored by how weak my core felt. Like I remember the idea of sneezing. I thought I was going to split open. I mean, so it's a lot, like something that wouldn't have bothered me picking up. All of a sudden I'm thinking like, oh my gosh, I can barely hold myself up and take a walk and pick something up. It really surprised me by what happens when there's an incision in one's abs.
And one little tip for that I will say is my favorite thing after my cesareans was to keep a pillow nearby. If you ever feel like you need to sneeze or cough or anything like that, I would hold that pillow at my belly when I did that. So it kind of braces your abdominals. In many ways, it works the same type of support as the binder is doing around your abdominals. But that often helps a lot. I will echo Sarah. I loved my binder. It was my best friend. I think the only thing I would say is that if someone had a long pushing period before they had their baby, or if they have something coexisting with a pelvic floor problem like prolapse or something like that from a prior birth or something else, you have to be a little cautious with binders because you don't want to funnel too much pressure down to the pelvis. But if you don't have any of those problems, the binders can be amazing.
Yeah, I actually just want to make sure we all highlight that, because that's one of the things that I've had students have binders, not for a cesarean, but for just belly binding. And then they end up with prolapse. Like, if that pelvic floor doesn't have support, those organs have to go somewhere, and they're not going up, they're going down.
Absolutely, Deb, you're so correct. And so, again, I think that's why it's so important to really have kind of informed care, informed education, because we focus so much on kind of, the physical aspect of it. But, there are vulnerable areas in your body. Even if you've had a cesarean birth, pregnancy itself can affect your pelvic floor. And so regardless of how you give birth, you do want to just make sure that you're not funneling too much pressure down towards the pelvic floor if you do wear a really tight kind of waist cinching support. There are ones that even can come up from below, like a tight pair of underwear, or and it just gives compression, or a tight pair of leggings that can go over the belly as well and support the pelvic floor.
Oh, I didn't know that about that kind. Oh, interesting. Yeah. Well, let's actually jump to the pelvic floor. How does a cesarean affect the pelvic floor? Because I've heard people we'll do pelvic floor work in our postnatal. I'll be like, oh, I don't really have to consider that. I had a cesarean. My pelvic floor is fine. But if part of the core is cut, I'm assuming it affects all parts of the core, including the pelvic floor.
It absolutely does. And that's a common belief that people will have, is that I had the cesarean, my pelvic floor shouldn't be affected. But then we see in the literature that certain things like pain with sex, for example, is actually more common after cesarean birth than after a vaginal birth, and that's surprising for a lot of people. But when you look at the anatomy, it's not surprising at all. So I think one thing that's important to remember is that the abdomen and the pelvic floor are actually part of a pressure system. And so they work together synergistically and help to contract in coordination with your breathing diaphragm to control pressures through the pelvis. So what happens at one ends up impacting what happens at the other. Along with that, there are fascial connections. So, when someone has a cesarean, we see this incision on the skin, but it's not just the skin. It's going to go through the fat, through the fascia and the connective tissue, separating muscles, moving the bladder. And with all that, the scar tissue then actually is fairly deep. So there are fascial connections from the abdomen to the pelvic floor. So if someone has a lot of restrictions in their abdominals after a cesarean, it can actually pull on the pelvic floor and increase overactivity patterns of the pelvic floor, contribute to things like pain during sex, or even urinary symptoms like frequency, urgency. And then with that, because that system, the abs with the pelvic floor, with the breathing diaphragm, are so involved in our posture and our movement, we can also then see problems like back pain and pain around the pelvis. And that, again, is why we always recommend people to be evaluated and really look at these things, because there's so many different pieces to put together for patients.
I love that. So, all right, friends out there, if you had a cesarean, we still need to pay attention to your pelvic floor. I want to talk about scar mobilization. We're going to take a quick break. When we come back, let's dive into scar mobilization, what it is, how to do it. We'll take a super quick break.
Hey there! Did you know Kroger always gives you savings and rewards on top of our lower-than-low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details. Hey there! Did you know Kroger always gives you savings and rewards on top of our lower-than-low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Okay, we're back. So I'm loving this topic. So I know, I'm such a geek. So we talked about, you mentioned that deep scar tissue that can happen from the incision that can affect the pelvic floor. Talk about scar mobilization, the benefit of it, and then how does one do it?
So scar tissue, when it does heal, it sometimes may not be as mobile, as fluid, as soft as tissue that hasn't been affected by surgery or have a scar. And so the goal of the scar mobilization, and also we'll talk about desensitization, is to restore some of the normal mobility of that scar and of that tissue, which can help minimize pain, improve sensation, decrease numbness, and also scar restriction has been linked to, bladder issues, bowel issues, painful intercourse. So something that again should really be standard care for every postpartum cesarean mom. What we do is again, the first few weeks are just really focused on healing. Within the first 2 weeks, it's typically when any infection will arise. So you want to get past those first couple weeks and just make sure that things are healing well. After that, some of the tips that we recommend are just starting with some gentle kind of diaphragmatic, which is rib opening breaths, breathing to help reconnect to your core, reconnect to your pelvic floor, and just get a little bit mobility in that abdominal wall. Another thing that I just mentioned early on is getting up and walking and just having a nice upright posture, using a stroller, a bassinet, or something to kind of get you out of a hunched over position so that scar and that tissue can really open up and get in a more lengthened position versus a very kind of tight, restricted position. And then we'll teach people different stretches like cat-cow pose, or a little, backward bend and standing, a little bit of a gentle cobra, things to kind of just expand the belly with the breath. Often people are afraid to move, and so they don't. But gentle movement can really be key. And
sorry. So when are you seeing people to start to do this, 4 to 6 weeks or after 6 weeks?
All along that, we started around 4 to 6 weeks in our clinics. That's what I do. Every therapist may do things a little bit different, but then I've also seen women decades later. They have 30, 40-year-old children, and they're coming in where they're having bladder issues or incomplete bladder emptying or painful intercourse or constipation, and it can be linked back to their cesarean scar restriction.
Wow.
It's never too late. That's one thing we emphasize. And then if we're thinking about the immediate kind of postpartum recovery period, we start working on desensitization of the scar, which can use different materials or fabrics like a makeup brush or a piece of felt or a little rougher washcloth to just increase some sensation on the area surrounding the scar and then on the scar, and then working more on actually massaging and mobilizing the scar with your hands after it's healed. So that may take, that's kind of the first 12 weeks. You may be looking at that. But again, if someone hasn't started that immediately postpartum, they can always start that at any time, working on their scar. It's never too late.
And so just give me an image of so someone has a scar, they're 4 to 6 weeks after, and you said they desensitize like a brush or something like a washcloth. And then do they mobilize it with their fingers? Like, is it kind of rolling along the scar? How do they break up the scar tissue?
So there's lots of ways to do it. So what we encourage, so again, like Sarah was saying, the desensitization, that can happen early on. So people can start doing that really, after the first week or two to desensitize the scar, but they don't want to go really massaging the scar until 4 to 6 weeks. And they don't want to go into the incision until closer to 12 weeks. So the 4 to 6 weeks, they're massaging around the scar, and they want to start pretty light. So you want to see how sensitive is the scar? Some people will have very sensitive scars. And so they might just start by touching around their scar. They could start by just pressing in a little bit above the scar and doing little circles, or maybe gently compressing in the skin and stretching the skin around the scar. And then as they progress, closer to 12 weeks, wanting that healing to take place, then they can start lightly into the incision, stretching around the incision with their fingers. They can actually lift the tissue and kind of roll the tissue a little bit. They can do circles in all directions. Ultimately, we want scars to move the same way our skin does. And so you think about your skin, you can pull it in all different planes, and you want ultimately to have a scar that's able to move in that way as well.
That makes complete sense. So you're saying in the beginning, it's going to, obviously, because it's an incision, a deep incision, it's going to be sensitive. And so that's normal. But what would fall out of the realm of normal? Is there anything that people should, if they're looking at their scar or having some sensations postpartum for a cesarean, that they should think, okay, this is not just normal healing?
So it's so funny, Deb, because I feel like all of these questions were like, well, it depends. And so I'll start with that. It depends. Early on, looking for signs of infection. So again, within those first couple weeks, looking at redness, warmth in the area, an open wound that could be oozing or pussy or something like that that's really a little bit more emergent and where you'd want to contact your medical provider right away. After that, I wouldn't say that it's, these things are common, but some of the things that people experience that can be improved are, I have a lot of moms where they're like, oh, I can't wear pants on my scar, or like I'm really sensitive over the area, or if a button from jeans or denim kind of pushes on it, I just feel really uncomfortable. That's not an ideal situation. As well, if I've had, moms where they say, my kid just kind of like jumps on my belly and I feel myself like guarding because I'm worried he's going to touch my scar. My partner will reach around and kind of touch my tummy and it makes me, since. So a little bit of guarding, sensitivity to the area, also numbness for a prolonged period of time. Or even when you look at your scar, you may even look at the coloration where some of it can look a little bit darker color or kind of a more purpley color, or it can be puckered in some areas, or even kind of forming a shelf between your belly and the suprapubic area. So things that would say, this could use some work, or maybe I should try something to see if I can improve this. They're totally messed up and there's no hope. It's more along the lines of, there could be some things that could improve so that they don't have that sensitivity or discomfort. And again, there could be issues that are going on that they don't realize are linked to their scars, like painful intercourse, like back pain, breathing challenges, or bowel and bladder issues. So again, if you've had a cesarean birth, I always encourage people to kind of, if anything's going on, just working with a PT to get an assessment to see if there's more they can do.
I have a friend, we actually were just talking about this. She has 2 kids. Her oldest, I think, is 10 or 11. Maybe that's her youngest, and the older one's maybe a couple years older. So a bit out from her cesareans. And she was saying that she feels it, and you used the exact word she says, a shelf. And she's really, like, her belly is pretty flat on top, and then she's this little shelf, and then the pubis. Is that likely scar tissue?
It could be. So it just depends, and she would need to be assessed. So it could be scar tissue that is pulling in around the scar and creating that little shelf in the belly. Also with that, after a cesarean, because the abdominal wall is cut, it really can impact the activation patterns of the abdominal wall after birth. And I think that some people can develop patterns because of that activation where even a long time later after having a cesarean, their abdominal wall still isn't really firing the way that it should. And so I think sometimes too, the muscles not activating and supporting them well contribute to that as well.
All right. You just brought into a topic I really want to dive into. You just talked about cutting the muscles of the abdomen and then the activation and healing. So let's dive into that. So what's happening at a cesarean? How is it healing? What does someone have to take in consideration to start to find that core strength again and rebuild?
So, in the actual cesarean birth, or the surgical procedure, they don't actually cut through the muscles. They kind of move the muscles out of the way. But to get to those muscles, there are incisions made through skin, through fascia, connective tissue, through the uterus. So there are several layers of tissue that are affected and that need to heal. And that's really where the scar mobilization comes in, is working with those layers to get more mobility. And again, if we have a certain part of our body that has been affected or has gone through surgery, we can't always connect to that area. The abdominal wall, the deep abdominal muscles, which we call the transverse abdominal muscles, they work synergistically with your pelvic floor muscles. So what that means is when one fires, the other fires with it. So some of the ways that we get people to activate those is, one, with your diaphragmatic breathing, thinking about kind of taking that nice expansive rib opening breath, getting a little bit of kind of opening through the belly, and then on the exhale, doing what you would consider a pelvic floor contraction, and seeing if you can kind of start firing those transverse abdominal muscles as well, which are the deep abdominals. So that's kind of one way to do it, is to connect with the pelvic floor while you're working with the abs. And then you can also just kind of do some work on the abdominals themselves. I find that, a lot of people don't even want to touch their scars. They don't even want to touch their bellies. They haven't thought about it. And so part of it is, again, not just physically healing and connecting, but it's emotionally healing and connecting, and just starting to give this part of their body some attention that they may not have been doing, because it is kind of an area of discomfort or neglect, or just busy lives and not being able to tend to it. So I think breathing, pelvic floor activation, working that into stretches and exercises and things like that can be really helpful to start.
Yeah, we do. In postnatal, we break it down into, first find the pelvic floor. I have them on a block, like a yoga block. That's what my PT had me do. Just like, take the weight off your pelvic floor. They could be swelling, find that pelvic floor, and then TA, and then consciously put it all together, so that all the pieces connect. Because a lot of people I've had come back saying some are angry at their bodies because it didn't work how they wanted to. Some feel just disconnected. And then to know that they can start to fire things up and create another relationship with their body just through breathing. I think it gives them some encouragement that they don't have to start doing this hardcore ab stuff, but just simply finding that transverse abdominal toning through breath can be encouraging.
Yeah, absolutely.
So let's talk a little bit, Jessica, about you, because as a PT, throwing this at you, as a PT with your background in helping people, what was your healing experience like? Was it surprising, like what you knew, and then like were you able to follow your own advice?
Yes and no. So it's interesting because being a pelvic PT, I think patients oftentimes assume that I remember being pregnant, and I remember patients saying, oh, I'm sure you're going to have like this amazing vaginal birth. It's going to go perfect and all this stuff because you know so much about the pelvic floor. But my birth experience, but birth by nature is unpredictable, right? Mm-hmm. And my birth was unpredictable. Like I said earlier, I labored for 37 hours, my first birth, and then had a cesarean. And I think afterwards, one of the biggest surprising, I think, things to me was that I was so tired. I don't think I've ever been more tired in my entire life. And I think the process going through labor and going through the cesarean and then hormones and dealing with being a first time mom was so much. And so I think I was really surprised at how much help I needed immediately after. And it was a challenge initially to get that help. But my first cesarean from a healing standpoint went very, very smoothly. And, I would say I sort of listened to my own advice. I did start doing scar desensitization and mobilization and everything early on, and progressed myself in terms of my abdominal strength, and everything went fairly smoothly. It's interesting because my second cesarean, which was planned for a lot of reasons, but I had a little bit of more difficulty. And so with that cesarean, I ended up losing a good amount of blood during the birth, and so was having difficulty with blood pressure and passing out afterwards. And then I ended up having a nerve injury right afterwards, where I had pain down my leg right after the birth. And it's so funny because fast forward, I taught a course on postpartum recovery, and I was talking about nerve injuries that happen after cesareans and the typical timeline that it takes for healing. And I was looking at my notes and it was exactly my experience that nerves take time to heal, and it took time and then it got better. But I needed more help in terms of rehab afterwards. And so I actually did end up working with a PT. I worked with a pelvic PT who works at my practice, and just to try to reconnect with my pelvic floor and my lower abdominals. My abdominals were the hardest thing for me to connect with after my second cesarean. And that was a good process for me, going through being a patient and having the struggles that all patients have. I had a hard time fitting the exercises into my daily life because I had a 3-year-old and a young baby. And, I think in many ways going through the whole process has made me much more empathetic to my patients, because it helped me to understand the challenges that go into a lot of this, and it helped me to know that we really need to give more grace to ourselves and more grace to our patients, and that most people are really doing the best they can with what they have at the time. So.
Yeah. I'm totally throwing this at both of you guys. I didn't prep you for this question, but we're talking about seeing a pelvic floor PT, and it occurred to me as you're talking about seeing somebody, and I saw someone that kind of put me back together. What can someone expect from working with a pelvic floor PT? Because I'll admit the first time she did some internal work, I'm like, okay. I guess this is what we're doing. But it's not like, and I was a dancer before, so I'd had a lot of PT on like my ankles and my back and my knee and my shoulders, but this was very different. So can you give a sense of because we're recommending for people to have this, it's not your sports injury PT.
That's correct. So, it's so funny because we'll have patients come in and they're like in their sneakers and their workout gear, and they're like, I'm here for PT. I'm like, well, you can wear anything because you'll be taking it off, So, it's interesting because I think we can really demystify what pelvic floor therapy is. And it's people don't know unless you've been through it. But I think the first thing is, it is like any other typical medical appointment or physical therapy appointment, where your first session, you're going to go in and it's in a private treatment room, one-on-one with the physical therapist, which I think is really important because you are going to be talking about really intimate issues, and you may not want to do that in the middle of a big, exercise gym, but they will ask you questions and you guys will have a conversation about what brings them to physical therapy and what issues are they having. And they may ask questions about, urinary function, bowel health, sexual function, exercise, birth history, and just get a good overall understanding of what their pelvic health looks like, which again includes bowel health, bladder health, sexual health, menstruation, menopause, all the things. And then we do an external physical assessment where we would look at their low back, their abdominals, check, any muscle tension on their inner thighs. And then we do, with patient consent, an internal pelvic floor muscle assessment. And the way that we access those pelvic floor muscles is through the vagina, through the vaginal opening, and or through the rectal opening. So, typically it's through the vaginal opening, if it's a first session, unless they are having rectal pain or bowel issues or tailbone pain. And then what we do is we assess their muscles. We look for strength by doing what's called a Kegel exercise and seeing if there's good activation there. We look for coordination with the abdominals and the breath. And then we also look for weakness if there is some laxity to the muscles or tissues, decreased endurance, decreased pelvic organ support, which can look like pelvic organ prolapse, or if there's tension, if there's a lot of tightness or tension in these muscles. I think one of the interesting thing is, which I still see and hear all of the time, the narrative is do your Kegels, oh, just do your Kegels. And one, the research is showing that a lot of women don't know how to properly do Kegels without individualized instruction. So they're likely not doing the right exercise and could even be doing the wrong exercise, which could make their symptoms worse. So the one-on-one care and instruction is really important. And as well, a lot of people have muscle tension. So Kegels are going to make that muscle tension worse. So Kegels are not the answer for everyone. And if they do have a muscle tension issue, it's important that they, work more on lengthening and relaxing these muscles, which can often be the case after birth. We think of it's just weakness, but it really is. They may also have tension that needs to be addressed before they move on to a strengthening regimen if it's necessary.
Yes, let's just highlight that. It is not just about the engage. It's about the release.
Correct.
It's about the balance. You want your pelvic floor springy like a trampoline, not held tight or hanging and saggy. So it's about, I love everything you're saying. And that's why we encourage, I encourage my students in class, not maybe while they're in class, but later, like, get your hands around your own pelvic floor, like feel are there trigger points or tightness around your sit bones, what's going on? Because that can give them some information. If they don't have access to a pelvic floor PT, they may need to investigate a little on their own and make some decisions. Yeah, it's definitely, I hear too much of just to Kegel it up, and that's certainly not the answer. Oh, you guys have so much great information. All right, we're going to take a quick break. When we come back, if you both can offer one tip or piece of advice you'd like to offer new and expectant parents, we'll be right back.
Hey there. Did you know Kroger always gives you savings and rewards on top of our lower than low prices? And when you download the Kroger app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Kroger today. Kroger, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Okay, we're back. All right, Sarah, you go, and then Jessica.
So my tip is just a general one, but it would be to be proactive in your pelvic health. So that includes everything from during pregnancy. If you are experiencing constipation, learn how to poop properly, work with a pelvic floor PT, make small changes in how you move, get out of bed, pick up kiddos or lift weights so you can protect your abdominals and your pelvic floor. And then even doing childbirth preparation to learn how to push well, how to utilize different positions for pushing, or if you have a cesarean birth, things to expect in recovery, and how to connect with a PT for scar massage or mobilization. So just really being proactive, just like we would prepare for any other, huge physical transformation in our lives. I think that this is one that we often don't think about needs to be tended to. So being proactive would be my tip.
Oh, that's a great tip. All right, Jessica.
So my big tip would be that self-care is not selfish. I think that new parents, there's this tendency to want to put everyone else around you in front, especially your children, and to put yourself on the back burner. And I've been there, to where, it's funny because even if you look at some of the little comics about moms, it'll be like, oh, haha, that mom got a shower today and that was the big win. But like hygiene should not be the end game. You know what I mean? And so
I do. I laugh because it sometimes is, but yes.
It is sometimes. And I've been there where that shower is like amazing. But that being said, I think that prioritizing your self-care helps you to actually be a better parent. And so, if you're sitting there struggling with some things after you had a baby or before you have a baby, don't just keep tossing all that on the back burner. And that jumps to Sarah's tip. Be proactive. Take care of yourself, because if you don't, it'll be harder for you to be everything that you're wanting to be to others if you can't be everything you need to be for yourself.
Oh, such good tips. I'm going to throw a tip in. Oh, okay, people, go see a pelvic floor PT. All right, that's my. Clearly, you think I love
feel like
that.
I want to, just record what Jess said and like replay it every day. I was like, that was so moving, but it's true. It's just, I think we need those reminders and, support and encouragement from other moms that we're not alone in this struggle and that it's okay to take care of yourself. It's actually necessary and beneficial for everyone in your family.
And you deserve to be taken care of. And you deserve, parents deserve a healthy body, healthy mind. Because how are we going to set that example for our kids if we can't take care of ourselves? And it'll make us just more available if we're not struggling.
And
remember,
one last little thing, if I can add in a second tip, would just be to give yourself grace and be patient with yourself. Because I think that, we talk about all this stuff about being proactive and self-care and all this, and I don't want anyone listening to feel a ton of guilt. And if this isn't you right now, or, if things are not going the way you want, or you have an exercise program and you're not following it or whatever, I think that we all, each day is a new day to take a step forward for yourself, for your health. And it's okay if yesterday didn't happen the way you wanted to. So just give yourself a little bit of grace and then be proactive.
Oh, Sarah, Jessica, that was great. Thank you. Because clearly you know how much I love pelvic floor PTs. Where can people find both of your work?
So I my biggest presence is on Instagram as the Vagina Whisperer. So it's the _Vagina_Whisperer, where I just kind of share a lot of tips about pelvic floor health, pregnancy, postpartum, the courses that Jess and I do together, and just about just general motherhood and life. I think it's become a really amazing community for me, just going through the same transition that everyone else is going through. And then my website is thevaginawhisperer.com, where, again, we have a lot of blog posts and kind of the services we offer for in-person and online support.
I really love that name.
It sticks. It's been sticking around. So it's working so far.
All right, Jessica, where can people find your work?
Yes. So I'm also on Instagram, and I'm at Southern Pelvic Health. And then along with that, I do write a blog where I educate on all different topics related to pelvic health. And that is at Jessica Reale, Reale, PT.com. And then one other, with Sara and my classes, so Sara and I do all sorts of classes on pelvic health. We actually have a postpartum cesarean recovery class, which is, I think, especially great for people who are very early after their cesarean or are planning to have a cesarean. And all of our classes are online at pelvicflooruniversity.com.
And I will make sure that is in the show notes. I wanted to thank you guys so much. I've thoroughly enjoyed this conversation, and I think that the community will really benefit, whether you've had a cesarean or not. For the listeners out there, just the tips about pelvic health and really putting yourself first, and it's so important. So thank you so much.
Thank you for having us, Deb, and just, really sharing this information with your community and your audience. It's really a pleasure and an honor to be able to kind of inform people about their health in this way after birth.
Thank you
so much for having us. This has been a great conversation, and I'm excited that you've been so proactive in educating your community on these topics. So thank you.
Oh, you're so welcome. All right. Enjoy your day. Be well.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.